speak what you did.
No.
You were in
I was
car.
on about 15 June 2007. I was in a car accident. I believe I blacked out for I don't know how long. When I came to, a few minutes later, the bones in my neck just started cracking. You could hear them. And I did not go to a hospital or anything. I just thought it was a minor whiplash or something. Whereas I knew I was going to be feeling sore for a couple of weeks and then everything was going to be all right. But it didn't go away. I went to my primary care doctor and he treated me because I had swelling, and so there was, he called it soft muscle tissue that was probably damaged, so he was treating me with that with Motrin and some other things, and I went back because the pain was still there, and I told him basically it wasn't going away. So he said, "Are you taking what I told you?" I said, "Well, I think I am." He said, "I want you to take it exactly." So I went away for another 2 weeks, and then the pain was still severe. So that's when he decided to send me to a pain doctor and rehab doctor. So I went to them, and there are a few friends of mine who are neurosurgeons, which they thought it was a broken bone in the back of the neck. And so I told, when he touched me, basically, he couldn't. So he said, "You know what? I think I'm going to follow their advice and get an MRI." So I had the MRI done. And I took the results to my friend who is a neurosurgeon. And he showed me all the problems there were and that the bones were on the nerves. And then I went back to the person who was the rehab pain doctor, and he saw the same thing, and he said that he did not want to treat me. So he referred me to a provider who was a neurosurgeon, and they wanted a new MRI done, since one had been December and now it's May. So I had the MRI done, and they said that they think there was a little bit more movement, not only on the C4, 5, and 6, but possibly the 3 and the 7 was now probably dislocated. I think that may be the right word. And so I am preparing for surgery Wednesday, June 4th, 5:30 a.m. I've done everything to prepare my family. Everybody is here. And I was at a meeting with some friends of mine, and then I told them the extent of everything and the range of motion that the surgeons had told me about. And my friend, he said to me he didn't like my options, and he thought that I could get better other than, and he didn't, number one, he didn't like the surgery. I didn't either. I tried other methods. And when I told him about what was expected possibly after surgery, he indicated to me, "No, you need to be able to do more than that." So he said, "Well, I know a doctor I want you to see, and you must promise me you'll see this doctor before you have surgery." So since Saturday and all yesterday, he's, we prayed about it and everything. And he basically has been in contact with me like all day from Saturday up until now. Mm. And so finally, he was instrumental in getting Dr. Stack's phone number, which he knew Dr. Stack personally, and called when we had a three-way conversation this morning, and Dr. Stack gave me an appointment, which I'm very grateful for. And so I've been in here, I've been in pain all day. So what has occurred is some tongue pallets, I believe.
Well, just simple tests.
What?
Ready? All you're going to do is just like we did before. You're going to raise both hands high as you can
Okay.
until you feel the pain. You feel the pain already?
Yeah.
Where you feel it? Right there?
Well, right now I can believe it's a spasm.
Okay.
You're having.
Okay.
Okay.
All right. We're going to raise our hands.
And it's tingling now. So
Your hand is tingling?
the arm is.
Arm is tingling. Okay.
Okay.
Yeah, okay.
Mm-hmm.
Yeah, that one needs assistance. Okay.
Yeah. Yeah.
Okay. Okay, relax.
Okay.
Relax. All right. Let's try the other hand. Let's see how the other hand does. Good. All right. Good enough. Good enough. All right. One more thing. We're going to turn our head to your right side first. Okay. All right. Stop. Okay. And now the other way. Now the other direction. It's gonna be all right. It's gonna be all right. It's gonna be all right. That's the next one.
I'm trying. I think that's it.
Okay. All right, ready? All right, we're going to. It's gonna get better in a second.
Can I have a tissue, please?
Here we go.
Okay.
Ready? All right. That's all. I like that piece. Yeah. Take a deep breath. Just take a deep breath. How's the hand doing now? Is it coming down? Arm feeling better? Tingling? Pain? Spasm? Okay. Raise this hand. Okay. Ready? All right. Now, this hand. Couldn't do that a second